Good morning, ladies and gentlemen. Greetings from Stockholm, from the press room of the European Centre for Disease Prevention and Control, and we wish you a warm welcome to our press conference. My name is Andrea Horvat Kramaric, and I will be moderating today. We mark the beginning of European Immunization Week 2023 today, and under the theme, A Lifelong Approach to Vaccination, and the release of our two ECDC reports, Polio Situation Update and Annual Epidemiological Report for Measles. For that purpose, I have here in the room, as always, our ECDC Director, Andrea Amon, and we have Deputy Chief Scientist, Piotr Kramers. Before we start, I will have to give you a few housekeeping rules, so please remain muted during the address of our speakers. And when you want to ask the question, please raise your hand and please turn on your camera. Also, you can ask the question in the chat and I will read it out. This press conference is being web streamed and it will be recorded as well and placed on our YouTube channel afterwards. I believe all is clear and that we can start. So I will give the floor to our director. Andrea, the floor is yours.
Yeah, thank you, and a warm welcome also from my side. Today we start the European Immunization Week. And this week was conceived in order to bring the attention to one of the most effective medical interventions that from the last century that brought infectious diseases down, vaccination, the other being antimicrobials. And while the antimicrobials are endangered because we use them too much, the full potential of vaccines can still be improved. We want to raise today the attention in particular for two vaccines. The one is polio and the other one is measles. Because what we are seeing is that despite the proven safety and effectiveness of vaccines, many EU, EA member states and other countries in the world as well are seeing cases and often also outbreaks of vaccine preventable diseases due to the fact that the vaccination coverage is insufficient. Now, the COVID-19 pandemic has shown again the power of vaccines, because here the vaccines have played a tremendous role in not only controlling the pandemic, but also bringing down the severe cases and deaths and to protect the most vulnerable in our societies. Nonetheless, during this pandemic and due to the measures like the lockdown, the social distancing measures, the routine vaccination programs, particularly for children, have been temporarily disrupted in some of the EU EA countries. In addition, we have seen the increase of misinformation and disinformation related to vaccines, mainly targeting the COVID-19 vaccines, but also having repercussions on vaccines in general. Now, these challenges in the uptake of vaccines have predated the pandemic in many of the countries and are due to deeper issues in achieving sufficient high uptake of vaccines. As an example, for instance, in one of the reports published today, we show that between 2012 and 2021, approximately 2.4 million children in the EU have not received their 3 doses of polio vaccine in time. 2.4 million children. And while the European region has been kept polio-free for 20 years, the virus continues to be detected periodically, either as the wild virus or the vaccine-derived virus. And due to adequate surveillance and still a relatively high vaccination coverage in the population, these sporadic events have fortunately not yet led to a sustained transmission in the EU or detection of human cases. Nevertheless, as long as there are non-vaccinated or under-vaccinated population groups in Europe, polio is not eradicated worldwide, the risk remains that the virus is reintroduced in Europe. Now, even in countries with a very high coverage, there are subgroups of population that are under vaccinated or not vaccinated at all. And that is why there is overall still a risk posed by poliovirus in Europe. The highest risk of reintroduction and sustained circulation is, of course, where susceptible populations are clustered together. And that is also the case for measles, which is highly transmissible, meaning that in order to really block the transmission in the population, 95% of the population need to be vaccinated with 2 vaccine doses. And as this is in many countries not the case, that may lead to outbreaks and can also create a burden on the health system. And while we show in our latest annual report that in 2022 there was a decrease of 99% compared to 2018, this was most likely due to the control measures implemented to contain the SARS-CoV-2 virus. Meaning, since February this year, we are seeing increased case numbers of measles in several countries, which is basically the most significant increase that we see since the COVID pandemic. And that just illustrates how important it is to maintain a high vaccination coverage in the population. Now, so far, I have been speaking about vaccination in children. We want to advocate today also that vaccination is something for the whole life. Vaccination programs also address people in their adolescent years, adults, pregnant women, individuals living with chronic diseases, and the elderly. Vaccines such as HPV are particularly aiming at teens, while the annual influenza and pneumococcal vaccination and COVID-19 vaccines are recommended for medically vulnerable and the elderly. And for adults, many countries recommend boosters of diphtheria or tetanus. So we want to use this opportunity to encourage all individuals across all age groups to consult the national vaccination strategies, to speak to their doctors, and to make sure that they do not miss out on recommended vaccine doses. Continued work has also to be done in hard-to-reach populations such as refugees, migrant, asylum seekers, and other vulnerable and underserved population. With accelerated efforts to improve the immunization, like campaigns to promote also vaccine acceptance and uptake, a high vaccination coverage can be achieved. And for us, it will remain a key priority to support and strengthen the national routine vaccination programs on the principles of quality, safety, and effectiveness of vaccines, as well as their timely and equitable access. Thank you.
Thank you, Andrea. And now we go to the address of the Deputy Chief Scientist, Kramars. Piotr, please go ahead.
Hello, everyone. Let me go into more details about these 2 reports that our director just mentioned. These are reports about polio and measles, and let's start with polio. The global situation is such that we still have circulation of the wild polio virus. It's circulating in Afghanistan and Pakistan, and last year we've seen also cases in Mozambique with some genetic links to strains circulating in Pakistan. On the other hand, we have circulation of so-called vaccine-derived polio viruses. These are viruses that come from oral polio vaccines that are used globally in many countries. They are not used in the European Union anymore, but they can, in a situation where there is low population immunity, low vaccination coverage, they can circulate in the population and they can accumulate over time mutations that may mean that they can cause at some point paralytic polio. And we've seen also detections of polio viruses in environmental samples in wastewater. On the other hand, we have this gap that our director mentioned of more than 2 million children just in one birth cohort that accumulated over time and they are under-immunized. And it's not an exact figure, it's difficult to be exact here, but it means that potentially we have millions of children that are under-vaccinated and they tend to cluster geographically in some areas. And when a virus is introduced to such a population, we may see cases and we may see outbreaks. Let's move on to measles. When you look at our report, you will see that we recorded quite a low number of cases last year, 127 cases, which translates into a very low reporting rate, much lower than that in the pre-pandemic years. This is most probably an effect of the pandemic. On the one hand, we've seen all these physical distancing measures introduced in the countries. Schools were closed, children stayed at home. On the other hand, the access to healthcare settings was limited. A lot of general practices went virtual, so it was more difficult to diagnose measles, and a lot of the personnel in laboratories was repurposed and moved to diagnose COVID, which all probably had a lot of impact, and that's why we see this low rates. But I would like to highlight two figures of this report. One is that the highest rates and the highest numbers we've seen in the age group below 1 year of age, and the infants. This is the group that is not usually vaccinated. Vaccines don't perform very well in that age group, which means that the only way to protect them, and these are quite weak members of our population, the only way to protect them is through high vaccination coverage around them. It's a matter of solidarity. We all have to have high vaccination coverage to protect the infants. And another figure that I wanted to highlight is quite a high rate in young adults, unvaccinated young adults, which means that measles is no longer only a childhood disease. It can affect adults as well, and it's quite important to really close immunization gaps also in this age category. In terms of the vaccination coverage, we've seen some drops, both in polio coverage and in measles vaccination coverage, most probably caused by the pandemic, the disruption that the pandemic caused to immunization systems. But overall, I have to say they've been quite resilient, thanks to the hard work and dedication of the vaccinators, doctors, nurses, and all the vaccinating personnel, and this has to be really commended. Nevertheless, the thing is that even before the pandemic, the vaccination coverage, for example, for measles was suboptimal. As our director said, in many countries, it was below 95%. And this is with the 2 doses of measles containing vaccines. And this is the level recommended for interruption of endemic transmission. So a lot has to be done to close vaccination gaps. And what we really would like to highlight in our reports is that on the one hand, the member states of the European Union and the European Economic Area need to have well-functioning surveillance systems, and we support them in this because we need to know when the cases occur and where they occur to be able to address them properly. We need to keep, as I said many times, by now high vaccination coverage, and we believe at ECDC that this has to be done through targeted, tailored immunization campaigns and information campaigns with information targeted to the populations to address their concerns, really. And finally, to know where to focus our vaccination efforts, we need well-functioning immunization information systems, vaccination registries. And we as ECDC, we already put out some guidance on to help the countries establish such registries or improve them. I'll stop here and I can take questions. Thank you very much.
Thank you, Deputy Chief Scientist Kramars, and I will open the floor for your questions. So please go ahead, raise a hand or post the question in the chat. Okay, we will wait a little bit more so to see. Okay, we have Mose. So Mose, go ahead, please ask the question.
Yes, okay, thank you very much. Okay, you can see me now. Okay, I haven't yet read the report and so on, but I would like perhaps to ask about what you think about those groups which are not vaccinated or against vaccination. I mean, you mentioned perhaps is it because of religious reasons or theosophic other reasons, and how can we argue against those who are against vaccinating their children? And what about the risk? You mentioned also refugees and migrants. I mean, is that a risk to understand? Are they not always covered by the national, let's say, vaccination programs for children? Thank you.
Yeah, I start and then Piotr will fill in with some details. The reasons that you mentioned are exactly what is the first step that you have to find out. When you have people that are not vaccinated, it is important to know why. And there might be a variety of reasons that you need to recognize before you can address them. Sometimes additional information helps, and sometimes it is so deeply seated that information doesn't help. Now, for specific groups, I think it is indeed good to integrate them in the national systems from the very beginning, from the arrival in the countries. But often there is also, of course, some reluctance and hesitation because a lot of the vaccine acceptance is relying on trust towards those that give the vaccine. And especially when you are new in a country, that is not always the case. Piotr, please.
To follow up on what our director said, we published some time ago a report to help the countries diagnose the situation why people are not vaccinated, and there are several reasons. It's based on a so-called 5C model developed, I think, by the University of Erfurt, Cornelia Betsch and her team. And one of these C's is confidence. People may not be confident that vaccines are safe or effective, and we have to address this. Another one is complacency. People haven't seen the vaccine preventable diseases anymore. Diphtheria, polio, these are diseases not seen by the population and even by the healthcare providers often. So the sense of threat is not there. And often the another C is constraints. Sometimes there are constraints in access to vaccination. And one of the important C's in this model is lack of collective responsibility. We try to spread the message that vaccines are a matter of solidarity. We vaccinate ourselves not only to protect ourselves, but all the others around us. And a big issue here, and we just not produced the report and it's not sitting on our website, but we ran during the acute phase of the COVID pandemic a series of webinars to work with the countries to make it operational, to help them diagnose the situation and address it locally. And I would like to finish with the thought that this is also a matter of equity. Of course, there are populations where like asylum seekers, refugees, migrants, where they are so-called hard to reach populations, and they may need some special support. We've seen it last year with a lot of influx of refugees from Ukraine during from the beginning of the Russian aggression in Ukraine. And as ECDC, we ran a series of missions to the countries where EU countries where migrants came to and refugees, to also help them with approach the immunization situation of these migrants, because they are a vulnerable population. So this is a big equity issue, and it has to be, we have to keep it in mind.
Thank you, Piotr. Mose, I hope your questions have been answered. You still have a hand. So...
No, sorry. No, it's okay. Thank you very much for the replies. Thanks.
Okay, thank you. Thank you for the question. And now we go to Damien Colomb. So Damien, go ahead.
Yes, thank you very much. In fact, during your presentation, you made a connection between the COVID pandemic and the decline of vaccination in certain group and certain cluster. Can you be more specific about the connections that can be made between the events of the pandemic and the ongoing slightly decline of immunization?
Yeah, thank you. There are two aspects. One is during the pandemic, the physical interaction between people and doctors was limited for quite some time. So the vaccinations couldn't be administered. And that might then have led to later on that they were not thought about anymore. So one is just the opportunity was missed. And the other is that we have seen this also previously, pre-pandemic, that when there was one vaccine where there were misinformation or even disinformation circulating, that this has had ramifications for other vaccines as well, because people then do not make a distinction between one vaccine or another. So here it is then really to really approach the individuals, give them the opportunity to ask their questions, and try to convince that the vaccine is safe and it's a benefit to get actually vaccinated.
Thank you, Andrea. Thank you for the question. And we have one more question. We go to Angelo Di Mambro from ANSA. So Angelo, over to you.
Good morning, Angelo Di Mambro from ANSA. Thanks for the briefing. You said that a suboptimal coverage of measles vaccination might probably lead to an increase in the number of the cases in the next future. What is the optimal coverage? Which 99, 98, 90, what is the optimal coverage?
What is recommended by the WHO is at least 95% vaccination coverage with 2 doses of the measles containing vaccines. This is quite a high threshold for vaccination, because measles is a very contagious disease, and it's very easy for the virus to kind of find, to use kind of to use this kind of comparison, to find any persons who are unimmunized or underimmunized and cause cases or even outbreaks of disease. So the higher the chance, if somebody has not been vaccinated and had a close contact with the person with the virus of getting infected, is more than 90%. And when a virus gets into a population which is not immunized, one case of measles can cause 12 to 18 cases, new cases. So it's very contagious, and that's why we have a very high threshold for vaccination coverage, and it shouldn't be only achieved at the level of the country, but also in every geographic area, in every population, consistently.
Thank you.
Thank you.
Yeah, hope you got your answer. I have one question in the chat, so I'll read it out. So it's from Romain from Mediquality. The political situation in many European countries is getting less favorable to health access for migrants. In France, some are thinking of withdrawing the Aide Médicale d'État, which gives access to basic care for migrants. What do you think at ECDC of these issues? Are these political attitudes a risk for infection control? Thank you. Who would take that? Andrea, please.
Yeah, thank you. As I said, I mean, it is actually regardless who is not vaccinated that can then contribute to a suboptimal vaccination coverage. The situation of migrants is often very, very different depending on the disease situation in their country of origin. But it is definitely recommended that migrants are offered the same vaccinations as the country in where they will then be living.
Thank you. I have another question from the chat. So it's from Gary Finnegan, Vaccines Today. You mentioned an increase in cases reported since February. In which countries are you seeing cases reported? So what, Piotr, maybe?
It's several countries. The largest number we see in Austria. But there are also other countries affected. We can come back with you with a list of countries where these cases are registered today.
It's really 1-2 cases in many countries, plus a larger number of cases in Austria. That's what we know.
Thank you. Do we have more questions? More maybe in the chat? No, that's it. I would just want to remind you that both of our reports have been published. So if you have any additional questions or any questions at all, please come to us to our press office. And also I would like to say that we have published today the podcast regarding vaccination, which is also an interesting source of information on the topic. If this is all from you, I would like to say thank you for attending. Thanks to our speakers. And until some other occasion, stay healthy and greetings from Stockholm.